It's been a long road over the last several months, and we're really sort of at a transition point in terms of the public health response to the H1N1. As you know, up until now, we haven't had access to a vaccine, and so we've been really sort of reliant on making sure folks at home use good manners, like not sending your kids to school when they're sick, making sure you stay home from work if you don't feel well, and those kinds of things, washing your hands. All those things are things we've been focusing on over the last several months, but we've also, inside the public health system, been making a real focused effort to put together mass vaccination plans for each of our county jurisdictions. And we're finally at the place in the public health response here in the next few days where we will be transitioning into a period where we have access to a tool that we have not had previously, and that's a very valuable tool called vaccination. And so how we execute this vaccination plan across the state is going to have a big impact on how well we do going forward in terms of making a dent in this H1N1 pandemic. So I'd like to focus today's questions at the end and sort of the comments in the broad spectrum of the public health and medical response system. And so we have a big advantage today in that we've got many of the local health officers from our county jurisdictions, as well as folks from the private sector community and folks that actually provide care to kids in the pediatric community. So you've got access today to a lot of folks who can answer some of those detailed questions that you might have regarding the broad spectrum of the public health system response across the state. And again, as I said, we're really at the cusp here as we transition into October towards including this valuable new tool of the mass vaccination program for H1N1. So with that, I'll make a quick announcement about what we're doing today, and then we'll transition to our local health officers. Today, we're placing an order for about 70,000 doses of vaccine to the CDC. The doses that we're putting in for that are available happen to be the live attenuated virus, or essentially the nasal spray vaccine that's most appropriate for folks who are otherwise healthy. So these initial doses will be going out in different counties in different ways, and you'll have the ability to ask each county health officer how they're planning to distribute this initial bolus of vaccine. And then as we transition into mid-October and into late October, we'll be getting a lot more vaccine, and our county health departments will be responsible for a lot more coordination in terms of rolling that vaccine out to the folks that live in our counties across the state. So with that, I'll introduce Bob England, who's the local health officer here in Maricopa County, and whose jurisdiction has more than 4 million people, I think.
Exactly. Hi, I'm Bob England. I'm the director of the Maricopa County Department of Public Health. You'll hear different ways that different local health departments are rolling this out. I'm going to explain ours. We're getting about 37,000 doses of this live attenuated nasal mist vaccine. If you think about that for half a sec, that's less than 1% of our population. So we have to use this well. And where we are going to send this initial vaccine is to healthcare workers, emergency medical workers, and especially healthcare workers who work in hospitals. And I'll tell you why, because they're the backbone of our response to this. We are all going to rely on the healthcare worker community as many of us become sick in the coming months. I mean, think about it. If you're on a plane flying somewhere and there's an outbreak on the plane, who do you most want to keep healthy? The pilot, right? Well, it's the same kind of thing. We need our healthcare worker community to be healthy. So that's where this initial batch of vaccine is going to go here. I'll tell you something, though. I want to make a plea to healthcare workers themselves, okay? Use this. When you get offered this vaccine, please take it. No one isn't going to be more likely in the face of the most vulnerable patients we have than healthcare workers. The last thing in the world you want to do is accidentally infect somebody who you worked so desperately hard to try and help. So please, please, please take it. It's a very good thing. Will said that how we use this vaccine is going to make all the difference. He's absolutely right. It's a good thing that this vaccine is getting here, because right now we are in a flat-out race between how fast we can vaccinate and how fast the disease is spreading. Just in the last couple days, we've had reports from a half dozen middle schools of significant outbreaks, a few preschools of significant outbreaks. We have reports of increased rates of hospitalization from this and other indicators. I think we're just at the beginning of our way up that second wave of the pandemic that we've been talking about for a long time. So we need for people to accept the vaccine as soon as it's available so that we can get as many people vaccinated in the right groups as possible to decrease the spread of this disease in the community and slow it down for all of us. In the meantime, that means for right now, until the vaccine's available to you, we need to keep the pressure up on all the old stuff we've been telling you all along. Washing your hands, keeping your hands away from your face, covering your cough, and especially staying home when you're sick, and keeping your children home when they're sick, because how fast it spreads in the schools is going to make all the difference in the world in terms of how fast it spreads in our community, and we need it to go slow so that we can vaccinate as many people and protect as many people as possible. And with that, to show you how another local health department is approaching this is Tom Schreier, the director of the Pinal County Health Department.
Thank you, Dr. Bob. Pinal County has a very similar strategy to Maricopa County in many ways, at least for the initial phase. I think what I would want to emphasize is that every county in the state is going to have a little bit different method of trying to reach the same goal. And the reason is because of the different challenges we face. For instance, in Pinal County, we have a pretty small healthcare system. It just really hasn't grown that much compared to the population of our county. So most of our folks come up to Maricopa County or go down to Pima County for their care. So for that reason, our initial bolus of vaccine will not only cover the healthcare community, but also we will be reaching out to the family members and the care workers of the children that are in the most high-risk groups, the most vulnerable population, to offer them the opportunity to get the initial doses of vaccine. Additionally, in addition to Dr. Bob's comments about the importance of healthcare workers getting this vaccine, certainly those folks that have access and have regular contact with these children that are in the most vulnerable situations absolutely should also do the same. I'd also put out a plea to all employers to really strongly consider changing your sick leave policies if they are restrictive. Absolutely, it will become a huge barrier for your workers to care for their families and for themselves if your sick leave policy is restrictive or punitive. And in the case of a disease that we're trying to stop the spread, clearly we don't want folks having their kids go to work or go to school sick, or having them come to work sick. We all have, I think, experienced one worker coming to work and sick, and then shortly thereafter the whole office is sick. And then when you multiply that across family, particularly family with children that are vulnerable, that can become a substantial problem. So I think as this rolls out over the next few weeks, I think you'll see some differences in the county strategies, but we are very much in collaboration, making sure that we take the best ideas forward with the resources that we have. And you know, if you live in a county other than Maricopa, then definitely you'll want to check out your websites and also your media to find out how it is that you're going to get the vaccine. Thank you.
Hi, I'm Robert Resendiz. I'm the health officer for Yavapai County. Now, our strategy will be similar to the others. We're expecting to get about 1,600 doses of vaccine, which is about 1%, a little less than 1% of our population. But we've estimated that about 2% of our population are healthcare workers, so this will be a good match for them. We were also, unfortunately, learning the bad news this weekend of our first H1N1 death in our community, and that, of course, has heightened awareness and concern. And we too are recommending that people do check the internet, the website. These statistics. These recommendations change quite regularly and fast. After this initial dose, we are gearing up to work very closely with our school districts. We have met with all superintendents, most principals, school nurses and such, and that will be our larger focus once this first wave of vaccine arrives. And we are geared up for mass vaccination clinics in the schools during the day for the students and in the afternoon for the general public. And that's it. Dr. Karcher from Navajo County.
I'm Wade Karchner, the health officer with Navajo County, and more than the other three that have gone before, I really represent more of the rural aspect of Arizona. And we face different challenges, but similar to what's been said before, we are really dealing with the healthcare workers as well as, in our county, the pediatric population, which will, as has been said before, also bear the brunt of this wave of the pandemic. Also in northern Arizona, we, in Navajo County as well as some of the surrounding counties, really have a unique relationship with the Native American tribes, and we have enjoyed a great collaboration with the tribes, with the Indian Health Services, and the state, and I would like to compliment all of those entities and how we've been able to, with this initial wave as well as the vaccine that's coming, really focus on making sure it gets out to those areas which are, at first blush, appear to be disproportionately affected by the pandemic. And so we've made concerted efforts to make sure that it gets to those people out there who truly need it. And with that, I'd like to hand it over to Dr. Laura Jablonski with the Arizona Academy of Pediatrics.
Hi, I'm a pediatrician that works in the East Valley, and I'm here representing Arizona Academy of Pediatrics also. I kind of wanted to give you a little more of a perspective of what's actually kind of going on in the community at this point and touch on a few just kind of practical things that families can look at. It does appear, especially over the past week, like Dr. Humble had said, we're starting to really see a surge in the cases that are looking like influenza. So it appears that it has arrived, and we're going to be seeing more and more issues developing with it around schools and daycare and work and all of those things that come up for families specifically. First thing we wanted to touch on is a little different than the H1N1 vaccine that they've been talking about with the rollout that's going to be occurring. It's just regular seasonal flu vaccine. We've been vaccinating, we've been able to do that for about the past month, but because of supply issues, we've had a break in the supply of seasonal flu vaccine, and they had moved over to work on producing the H1N1 since we're seeing such a rise in that at this point. So a lot of offices are now running out of their seasonal flu vaccine. So if you call your office and they don't have it, it's not anything to panic about. Each office is working on ways to deal with that and to address getting that out to their individual patient groups. And then what we have heard from the producers of the vaccine is that we'll be getting another round sometime in November where we can catch everybody up, which should be in time for when we normally see seasonal flu, which is usually later in the year. What we're seeing right now all appears to be H1N1. The good thing that we've learned about the virus is that it seems to not be as serious as we originally were concerned with in the spring, but it's still not a fun illness to have. So that's what we're talking to families about, getting prepared, having backup plans for what you're going to do when your kids do get sick or when you're sick and you're not able to necessarily care for them as well and need some help. Going along with that, we've been getting a lot of issues from kids being sent home from school since there does seem to be a significant outbreak occurring in several places. Notes being sent home. There's a lot of confusion over when to keep your kids out, when to send them in. If you're not sure, you can always call your healthcare provider. That's definitely a good thing to do. Make sure that you've got some feedback if you're not sure if they should stay home or if they should be seen. But in general, if your child just has one symptom, like just a runny nose or just a little bit of a cough, probably not the flu that we're seeing right now. But if your child has a fever, if they're not feeling well, if they're fatigued, they need to stay home. And just like it's been brought up several times before, common sense, stay home, rest, drink lots of fluids. And if you're noticing them getting worse, you're seeing symptoms that are not normal for them when they are sick, get them in, get them checked out. Because it's important for us to be able to work with the community on when we do need to be moving children to a higher level of care. Going along with that, initially there had been a lot of discussion about getting children in, getting them treated with the antivirals, and getting them tested with the rapid flu tests. Over us learning about this virus, we're learning several new things. First of all, the testing we have for influenza isn't as good as we thought it was for the H1N1 virus. So the recommendations actually now are that we don't test unless there's other specific ramifications going on, like underlying illnesses, they're being hospitalized, there's other environmental issues where we need to know specifically. And that's kind of based on clinical decisions that the healthcare provider will be making. But at this point, if a child walks in and I examine them and their symptoms are consistent with influenza, at this point we don't necessarily need to do the rapid flu swabs that you've been hearing a lot about previously in the year. So we wanted to kind of get that message out to families that that isn't necessarily something that's going to happen if your child is seen in an office or urgent care setting or a clinic. Secondly, along with that, there had been a lot of discussion about children getting treated with antivirals fairly quickly, especially early in the disease course. But again, we're finding out that it doesn't seem to respond, that the illness isn't as severe as it had originally had been thought, and so kids are able to fight it off on their own if they're otherwise healthy. So at this point, the recommendations from the Center for Disease Control are that we not use antivirals for the general population unless there are other factors figuring in, such as underlying illnesses, other problems with family members or caretakers. So that's something that's changed a little bit too, that we wanted to get that message out there to families, that you may not necessarily need the antivirals for treatment. But again, all of these decisions have to be made in concert with a provider who's looking at your child or your family member and seeing where they're at in the course of their illness. The other thing that I wanted to bring up was that now that H1N1 appears to really have kind of hit the second wave in our community, now's a good time to do some pre-planning. Good time to talk to your employer about what are you going to do if your child gets sick. Most of the children are out for at least 5 days, and that's a significant amount of sick time for most people. So it's a good thing to start thinking about now. Who's going to do the child care if your child needs to stay home and you have to be at work? If you get sick, who's going to help take care of the realities of life? So it's just one of those times, again, to kind of stop, think about how you're going to be addressing things as we head into this season. And that's all I had. And I'll be introducing Dr. Jeff Schultz.
Hi, I'm Dr. Jeff Schultz. I'm an emergency physician at John C. Lincoln, and I'm representing Arizona Hospital and Healthcare Association today. And I wanted to let you know that we are starting to see an uptick in our number of influenza-like illness cases in the emergency departments across the state, and specifically I've been personally seeing an increase in number of those. I want to echo what Dr. Jablonski said, is that we aren't necessarily doing these tests in everyone, that the test is of limited usefulness in an otherwise healthy person. So when someone comes to the emergency department, it's really more of a clinical decision. If it appears that you have the flu, you probably have the flu. As for our volume of patients, we are starting to see more cases, but we're not overwhelmed. The hospitals are all handling this. And the hospitals throughout the valley and throughout the state have a pandemic flu plan in place, so to speak, that if we do start seeing a significant increase in these numbers, that we have plans in place to handle that increased volume. But the message is that if you are well and you don't have problems, it's probably better for you to see your primary care physician or your pediatrician or your family practice doctor rather than going straight to the hospital, because for all of us it's best if we can avoid that situation where the emergency departments could potentially become overwhelmed. Again, if you have an emergency, if you can't breathe, if you have very severe symptoms, we're always there if you need us. But again, it's best if you're just concerned, it's probably better to follow up with your physician. I wanted to just discuss briefly that we are following protocols to limit infection transmission amongst our patients. Most of this is common sense, and it turns out that common sense works pretty well. It's putting a mask on a patient if they have a cough and a fever. It's good hand washing and hand hygiene. It's limiting exposure of otherwise well people to people who are concerned about those infections, and I think statewide hospitals are instituting these policies. It also means that if you're sick and you have a loved one in the hospital, it's probably a good idea to not visit them while they're in the hospital. If you have a child that is starting to come down with a runny nose and a sore throat, it's probably a good idea not to bring them to the hospital to visit grandma. Again, we think that we're at the beginning phases of this, to echo what the other speakers have said, and I think that as an organization, I think we're prepared for that eventuality if it becomes, if we start seeing more cases. Finally, just to echo with the vaccination information, we are encouraging all of the healthcare providers that work in the hospitals to definitely get the H1N1 vaccine. We think that it's quite important that you don't give the person who comes in for their chest pain and a heart attack influenza, and we think that this is a very important way to prevent that spread from happening. And particularly since as physicians and providers we tend to see the most vulnerable of the population, we want to ensure that we're not adding illness to their process. I think other than that, we're just working closely with the Arizona Department of Health Services and the county to make sure that we all stay up to date on their guidelines. And that's all I have to say.
A lot of people to ask questions of, and they're all here to answer any kind of questions you have.
Let's start with the acting director.
Yeah, if you don't mind addressing the questions to the people to make it easier.
All right. A couple of things. First of all, why is it that we're getting the nasal spray, which is not suitable for people with compromised systems first? Is that just...
Yeah, I mean, essentially it's really the logistics of how this vaccine rolled out of the manufacturing processes. So this live attenuated virus is available, it's ready first, it's been through all the FDA approvals and so forth. So it was really just a couple of weeks ahead of the bigger loads of vaccine that'll be coming later in the month. And so in some ways, it's really beneficial in a sense that we've got a small amount of vaccine that's going to be coming initially, and we're able to really use that as a pilot program to test the whole distribution system throughout the state. In other words, this represents about 1.5% of the total vaccine that we expect to get between now and January. So it's a very small amount, but it's also a useful test in terms of measuring our ability to execute this throughout our mass vaccination plans in terms of, you know, the cold chain management and all the other things that need to make sure that need to happen in order to make sure that you have a successful plan. So this initial piece is about 1.5%, and then as we go into the later stages of October, we expect to see between 800,000 and 1 million doses in Arizona. So there's a substantial amount of vaccine that'll be coming later in the month. This is a very small amount right now, and as you noted, this is the live attenuated virus and vaccine. So it's really that portion of the vaccine that'll be most appropriate for folks without complicated medical conditions.
Real quick follow. The 70,300, 700 Masomenas you're getting, among the 15 counties, are they being divided up on a pure population basis, or is there something else in the calculus here? In other words, if Dr. Bob is nice, he gets more.
No, it's divided up. It's divided up based on population, but there's a special population here, which you might want to talk about with Dr. Wade Karchner, which is our tribal population. And as you know, some of our tribal partners live in jurisdictions that cross different county lines, and so we spent a lot of time with our county health officers and with our partners with the tribes and the IHS to make sure that we're coordinating with our tribal entities. And that's actually one of the trickier issues because of the jurisdictional issues that you face when you've got tribal population. So Wade, do you want to talk a little bit about tribal partners in terms of distribution?
Sure. The distribution with the vaccine to everybody has occurred in that we have, with the state, all the county health officers have met and got together, and instead of sending all of the vaccine to the county health departments to have us distribute that, what has happened is that the state has reached out to all of the public and private providers of vaccine that are out there normally, and we're using those channels. So in conjunction with that, we have used the normal channels within the Indian Health Services as well as the tribes, and we've been able to sign all of those entities up as recipients of vaccine. And so in my county's case, we have 3 large tribes. We have pretty much the entirety of the White Mountain Apache tribe. We have, again, almost the entire Hopi tribe, as well as 1/3 of the Navajo Nation. And so what we've been able to do is we've been able to have them sign up their IHS facilities, their clinics, as well as the non-IHS, because as many people aren't aware, there are facilities on reservation land that are not affiliated with the Indian Health Services, but are actually run by the tribes themselves. But all of these entities throughout the state have been able to sign up and act as recipients for the vaccine, and I think that will be a much more productive, much more efficient way. They will be able to manage, and they have been able to step up and say how much they've needed and how much that their population will receive.
Will Arizona get additional resources because we're a border state? Anybody?
That would be Will.
Yeah, you know, we're fortunate in the sense that the federal government has spent a lot of time, effort, and treasure to make sure that there are adequate resources in place. And so our federal partners have made it clear that should the need arise for some special border issue that comes up, to make sure that we give them a call, because it's a priority for the federal government to make sure that the border area is considered in a unique way, because it faces unique circumstances. So if it were to, for example, if we needed additional antiviral medications, that sort of thing, I think all we have to do is really pick up the phone and talk to our federal partners, because essentially, you know, the funding for this response is almost entirely a federal government source. And so our federal partners are really a key part of this whole response. And I will say, they have been very forthcoming in terms of making sure that not just the states, but the tribal and the local health departments play a big role in terms of helping them to make national decisions about allocating resources. So I think the answer to that is yes, and by and large because the federal government has really been very forthcoming in terms of getting input and allocating resources.
Will, do you expect after this initial wave of doses, do you expect the rest of them to come in all at once, or are they going to come in bit by bit?
Well, I mean, I think really the best analogy that I can think of is that it's like turning on your garden hose, right? You turn on your hose and nothing comes out right at first, and then you get a little bit of water and it becomes gradually steadier. So I mean, that's really how the vaccine manufacturing process works. It's at the beginning, as you can see, we've got 70,000 doses that'll be coming into the state. Later on in the month and later on in October, we'll be seeing a lot more, between 800,000 and 1 million. That'll be a steadier flow. And I think as we get into November and December, we'll continue to see that steadier flow. And obviously, you know, it's not going to come in big, giant boluses, but rather just how things are manufactured. Things are manufactured, they come off the line, they're moved into the distribution chain, and then the logistics roll that out. And so we expect as we move through October and November to be putting in several different orders at various different times, depending on the availability of the vaccine as it comes off the distribution and manufacturing lines.
What are you basing when you say placing orders, like you actually have to tell the federal government how
Right.
many you want in this particular shipment?
Right. So what happens is the federal government purchased 100% of this vaccine. It's paid for by the U.S. taxpayers. So they gave resources to the manufacturers of vaccine. I believe there's at least 6 of them. So 6 of these manufacturers got together and began manufacturing the H1N1 virus vaccine. And so that vaccine is being produced in various different locations, not just in the U.S., but also in other countries. And so as those manufacturers roll out and complete the manufacturing process, it goes to a distributor, and then we work with the CDC to place those orders as they become available. And then the logistics after that are that CDC's got a contract with a company called McKesson. So the CDC's got a contract with McKesson, and they are essentially the distributor for the U.S. And so we put our orders into CDC. CDC notifies McKesson where to ship those doses of vaccine, but all of it's verified by the public health system across the country. And so in our case, we work with our tribal and county partners to establish those actual locations where the vaccine will be distributed and delivered. And so what happens in our case is we put the order to CDC, it goes to McKesson, McKesson ships directly, and we just do the verification. So you're not going to walk into the building across the street and see a whole bunch of vaccines sitting in refrigerators. We've bypassed that part by having McKesson ship directly to those folks that have requested vaccine and that the public health system has verified as a recipient.
Well, there was an interesting mention before that because of the ramp up for H1N1, that maybe we're going to have problems getting the traditional seasonal, free-package thing. Are we going to see shortages in regular flu vaccine, or is this be delays, or what?
Well, I mean, that is a good point. I mean, I think part of what we're seeing right now is the fact that the vaccination of kids has been accelerated by a few weeks because parents are so keenly aware of the messaging that we're coming out with as a public health system and through the medical community, that it's important to not only get vaccinated for regular seasonal flu, but get vaccinated for H1N1 vaccine when your turn comes up. And so, in general, the harvest season for vaccinating kids is really October, November, and even into the holidays. And what we've seen this year is that a lot of folks have gone into their pediatric providers as early as late August to get those initial doses of vaccine because they're more aware of influenzas, the risk of complications from influenzas. They're more aware than they had been in the past because of everything that's going on. So I think there's several factors at play here, one of which is increased demand, and the other side of the equation is supply. And so what we're seeing right now in terms of seasonal flu is essentially, the demand over the course of September has exceeded the supply that's available. There's a lot more coming, and many providers will be getting additional doses later on in the season. But really, it's a combination of factors of folks having more people seeking the vaccine earlier than they normally would have, and then combined with the fact that, as I just talked about, the vaccine rolls out in a process as it comes across, the manufacturing line, and sometimes that doesn't match the demand that the public has, and when that happens, the refrigerators get bare, and parents might get frustrated.
Okay, but I want to make sure I understand. Obviously, I understand flow and the early demand, but given you only have certain companies that can manufacture this, given you only have certain facilities, given this particular ramp up for novel H1N1, is everyone who wants a seasonal flu going to be able to get one, or are we just not going to have the supply of regular seasonal flu that we normally would? Yeah,
all of the information that I have seen from the CDC and from the federal government suggests that over time there'll be plenty of seasonal flu vaccine for everybody. The question is, will you be able to get it exactly when you show up? Maybe not. But over time, as we go through the course of the next several months, there'll be an adequate supply, assuming that demand stays, at a relatively high level and doesn't, go through the roof. Because remember, there's only a fraction of the, I wouldn't should say a fraction, but only a certain percentage of the population gets a seasonal flu vaccine year in and year out. And the manufacturing processes anticipate what they think they can deliver, and so part of the decision making on the process of the manufacturers is to make enough so that they can sell everything that they created, but not have too much inventory left at the end. But all indications are that there'll be an adequate supply. But remember, this is a long process, and the regular flu season really, typically in Arizona, doesn't hit until December or actually even January and February. And so there's a long way to go. But I think the supply of both of these vaccines will be adequate. It's just a matter of how you roll it out logistically to make it convenient for folks, and for sure to make sure that the folks who are most vulnerable have access to those initial doses.
Will there be mandatory vaccinations for health workers in Arizona?
I want to make this absolutely, this is one of the questions I've had. I had it over at the legislature and various places. The public health system in Arizona has no intention of making the H1N1 vaccine mandatory for anybody. We're strongly encouraging healthcare workers, especially parents that have kids in school, to get their families vaccinated. It's a great idea. The public health system is certainly encouraging that, but nobody is talking about making this vaccine mandatory in any way, shape, or form. Now, individual employers might make decisions in the workplace that would be over and above what the public health system would recommend or require. And so if you have any follow-up questions with that, you might want to talk to the folks that work in the hospitals and so forth. Do you want to address that?
I think it's really a case-by-case basis. It really depends on the hospital network. For physicians, I think we're all strongly encouraging it, but again, I don't have the specific data for each individual health network or hospital and what they're going to be requiring. Again, the recommendations are very clear-cut. It's beneficial, it's safe, it's strongly recommended from all aspects, and I think that that's probably where the majority of the thrust is going to be, rather than making it a mandatory vaccination.
Hey, Will, real quick, we've been hearing a lot about how pregnant women should get this H1N1 vaccine. This first stage of the 70,000, is it just healthcare workers, and then pregnant women should probably wait till the second wave of vaccine arrives?
Let me get a physician to do that one. Do you want to? I'll have Bob come up and talk about what he's doing in Maricopa County and what his intentions are.
Great.
Yeah.
The live attenuated vaccine is approved for healthy people 2 years of age to 49 years of age without underlying conditions. Pregnancy are one of the conditions that it's not approved for.
Okay.
That's the short answer. But the longer answer is that it's really freaking important for pregnant women and others at risk as well to get vaccinated when the vaccine is available to them. Pregnancy is always a risk for complications of the flu in regular seasonal flu. That risk goes up a lot historically in pandemics, and we're seeing it go up a lot so far in the data we have here. So make no mistake, they shouldn't put that off. And if a pregnant woman does develop symptoms of the flu, she ought to call her prenatal care provider like right away, not tough it out for a few days first, so that they can make the decision about antiviral treatment or not. Let me just say one other thing about what a big deal this is, what we're trying to prevent. I mean, yes, so far it looks like this novel flu in many ways is about the same level of virulence, makes people about as sick as regular seasonal flu. But a lot more people than in a regular flu season will get pandemic flu unless we successfully do the things we're talking about here and cut it short. So if history is a guide, you'd expect perhaps 3 times as many people to get sick. So if you have 3 times as many people getting sick and the same fraction of people getting seriously ill and dying, you should expect 3 times as many deaths. And if you look at the CDC's projections for the pandemic, they initially projected it's a guess, obviously. But if we didn't do things to intervene, as many as perhaps 90,000 Americans die. Well, Arizona's fraction of that would be a couple thousand people. So let's assume that they guessed high. Cut it in half. Say it's even 1,000. I just reviewed data this morning that so far about 1 in 5 of the deaths are children. Okay, that's a couple of hundred children who are at risk this year. That's why we need people to take this seriously. Continue the hand hygiene stuff. Continue to keep sick people out of the workplace and out of school. And get the vaccine when you can. Vaccine works when lots of people get vaccinated so the germs can't bounce back and forth and outbreaks can't happen. That's why we need, right now, the healthcare community to get vaccinated, and as soon as it rolls out to other parts of the population, we need everybody to avail themselves of it when they can, so that we can make this, as I suspect we will, much less severe than it could be if we just ignored it.
After healthcare workers are vaccinated, how many doses do you think will be left of that 37,000?
That's for Maricopa County. that's less than half the number of healthcare workers who work just in hospitals. So we're not even going to be able to get all of the healthcare community vaccinated with this first small amount. We want healthcare workers with direct patient care in Maricopa County, in hospitals especially, to avail themselves of it with this first wave, and that's where we're sending it, is almost entirely to hospitals. But as soon as more vaccine becomes available, as Will said, week after week, we'll finish off the healthcare workers and, importantly, get to children, get to those populations that are most at risk.
So we have the pregnant and children who are priority. What happens if someone's antsy and they're a normal, healthy person and they want to get a vaccine? Are they going to be told that they have to wait? How's that going to work?
We're going to encourage, from our standpoint, we're going to be pushing the vaccine out to places that will see people who are at the highest risk. We're going to encourage the first people to get vaccinated to be people who are in those top priority groups. To my knowledge, nobody's planning on being the vaccine police and enforcing that on somebody, so that if a family came in together and 3 people were on the tiered list and 1 wasn't, that the other person couldn't get it. But really, please, we need it to go where it needs to be first. So please allow people who need it the most to get first in line.
If somebody, like I said, if somebody's antsy and they think that, their health is a priority over and above, a children's health or a pregnant woman's health, what would you say to them, other than what you
You know what? I think that crises bring out the best in people quite often. And I fully expect that the vast majority of people are going to recognize that by letting people in the higher tiers get vaccine first, that they're not only doing the right thing, but with children are the primary spreaders of this and many other infections. The more we can get children vaccinated, the less this is going to spread in the community, and the less likely they're going to get exposed themselves in the long run. So the strategy is who needs it most and who spreads it most. And I really, really think as a community we're going to shine with this. I think people will do what they need to do.
So knowing that, will school districts be getting the vaccines? If so, when?
Again, you're going to see different strategies in different places. You already heard it alluded to here in some of the rural communities. In Maricopa County, mass immunizers are working with the school districts, our Mullen, Maxim, Health Waves, and so forth, and they are setting up clinic dates already. We have school-based vaccine clinics planned to go in mid-October, anticipating some of that vaccine, in order to reach kids where it's most efficient in the schools. But that doesn't get everybody, so you have to also provide vaccine to providers and to other places where people can, in those top groups, can get vaccinated.
We'll get back to the general angle of Sandy's question. I'm curious, because most of us are healthy. When would be the earliest that the healthy population can get there? Right. It seems a little unclear. So when would be about?
Well, I mean, there's really, when your question was about a healthy population, and there's 2 kinds of healthy populations. There's kids, and then there's adults like me. So for kids that are perfectly healthy, we expect to see most of the counties implement their mass vaccination plans aggressively in one way or another, many of them in schools, and that many of those kids will get their vaccines at some point in November, possibly even late October. As we transition out of November and into December, we'll be in a position to start making vaccine available to healthy adults like me. So a person like myself, a healthy person, late 40s, most likely my turn will come up right around the holidays or shortly thereafter. So it's really, the key here is to make sure that we're getting those initial doses to those populations that matter the most in terms of getting complications and also spreading this virus around the community. So that's why we're so focused on making sure that these initial doses go to the most important groups in terms of spread and complications. Healthy people, healthy adults without complications, probably, mid to late December, sometime around the holidays.
Will they be okay? That's the question. Will I be okay if I wait until November or December?
Well, you know what? You have control over that. To a large extent, people have control over their own destiny. Part of this has to do with making sure that you pay attention to common signals that you see. If you see somebody who's sick at work, ask them to go home and stay away from them. If you're around, if you're around the workplace and you have an opportunity to wash your hands several times a day. If you take those simple infection control measures seriously, you have the ability to control your own destiny. You can really decrease the risk of getting this virus by taking simple precautions, low tech, easy things like washing your hands and staying away from sick people. So there's two things here. One is, making sure that you're doing the right thing. And the other part of this is making sure that the community does the right thing. And by that I mean, that's that key factor of if you've got kids that are sick, or if you're not feeling well, don't go into the workplace and don't send your kid into the school while they're sick, because you're breaking your social contract with the rest of us, and you're making the spread of this virus a lot more explosive. So we have control of this. So that's the answer to that question is, you've got control.
For someone who's allergic to the seasonal flu shot, does that necessarily mean they might be allergic to the H1N1 shot?
Do you know how that works with LAIV? Is that in eggs and stuff too?
The primary allergy that people have that might prevent them from getting a seasonal flu shot is an egg allergy. But you have to have a really severe egg allergy for it to be an issue. Because the virus is grown in eggs, there's trace amounts, theoretically, it's really small amounts of potential for egg protein to be in that. So if you're somebody who has anaphylactic reactions to eggs, serious egg allergies, then you shouldn't get the vaccine that's grown in eggs. And it'll say right on the consent form, they'll ask you questions about issues you might have.
What about, is the LAIV grown in eggs the same way?
I believe anybody have better knowledge than me? I believe the live attenuated is grown in eggs, if that's the question. Karen, yes.
Karen says yes.
Is all of the vaccine this year available egg-based? Right.
Much better with bacon in the side.
Much better.
So if you're allergic to eggs, don't get the vaccine?
No. Go ahead.
Yeah.
Go ahead.
I think the main point with that question is that, as in most of these questions, you really need to talk to your provider or to the people that are going to be administering the vaccine, because we can say blanket statements, but that's where it's really going to happen at that level.
Well, can you talk about the effectiveness of those antibacterial gels? Are they?
Yeah.
Because we're on our own until December. We're supposed to be a healthy population, so we're trying to.
Well,
Antibacks, how good are they?
In general, the way I answer this question when I'm out with the parents of my kids in school and stuff, they always ask these kinds of questions. I always say the same thing, which is the lowest tech approaches work the best in most cases, and that means washing your hands. And it doesn't matter so much whether you use soap or antibacterial soap. What matters is how diligent are you when you wash your hands. It's no good to just stick your hands under the sink, squirt a little about, you do this for a second and rinse it off. That, doesn't matter what kind of soap you use. For that, it's not going to work very good. You just have to take those extra few seconds to make sure that when you do wash your hands that you do a good job and not just I'm in a hurry, I'm going to rinse it off real quick kind of a job. So it has less to do with what you use than how you use it. So anytime you're around hand washing sinks, restrooms, and the like, it's a great idea to wash your hands and spend a little extra time in there with the soap to make sure that you're doing a good job. If you're in a place where there's no hand washing sinks and it's kind of inconvenient, then the hand sanitizer is a decent alternative. Make sure that it has a really high alcohol content, that you don't buy the low alcohol content kinds of hand sanitizers. But those work pretty well too. But In general, the low-tech approaches work the best, and that means just old-fashioned soap and water and a little elbow grease, and don't do it in a hurry.
Thank you all very much for coming. These guys will be around just a little while. Thank you all very much for coming in today, and I hope we answered a lot of your questions. We'll keep you updated as best as we can. Thanks.
All right.